Welcome to Let's Talk Climate. I'm Bruce Bekkar, fellow at the Climate for Health program at ecoAmerica, and I'm co-hosting this episode with the American Public Health Association. I'm coming to you from northern San Diego on the coast, lands once shepherded by the Kumeyaay Indians. I'm looking forward to today's topic, Climate Action is Where You Are, with our guests, Dr. Qasimah Boston, who's the co-founder of the Tallahassee Food Network, Katherine Catalano, Deputy Director, Center for Climate, Health, and Equity with the American Public Health Association, Dr. Elizabeth Friedman, the Medical Director of Environmental Health at Children's Mercy Hospital in Kansas City, and Carly Hampshire, founder and co-director of the Planetary Health Report Card Initiative and fourth-year medical student at UC San Francisco. So let's start with questions for each of you. Carly, let's begin with you. What inspired you to create this Planetary Health Report Card, and tell us a little something about it?
Absolutely. Thanks, Dr. Bekkar, and thank you to ecoAmerica for inviting us to speak this afternoon. One of the things I've learned about effectively communicating climate change is that numbers none, but stories stick. So going to share my introduction to the Planetary Health Report Card and the work as a story. So I started medical school at UCSF in 2018. And that September, the deadly and destructive Camp Fire was raging through Paradise, California. Even if you weren't in California at that time, you may have seen pictures on the news of the hazy, smoke-filled dystopian sky at that time. It was pretty profound, to say the least. And contemporaneously with that awful wildfire, we were ironically in our pulmonary block in medical school. Yet, despite the fact that we were walking to school every day in N95 masks, through an eerie desk, breathing in some of the worst quality air in the world, with many in the region, especially the most marginalized, feeling the health consequences of that, there was no mention of the health effects of air pollution or wildfire smoke in our curriculum at all. And it felt like a real missed opportunity to address the impact of climate change on health. What was going on inside the classroom felt really disconnected from the outside world. So several classmates and I were struck by the profound lack of planetary health education, and we felt that as future health professionals, we must be prepared to address the impacts of human-caused environmental changes on our patients' health, and that this preparation was in the hands of the institutions providing our medical training. And it wasn't just about curriculum. We also wanted our institutions to have research focuses and community engagement initiatives, sustainable practices in their hospitals, and student opportunities that reflected the profound threat that climate change and other forms of ecological destruction pose to everyone's health. So to help catalyze that educational transformation, in 2019, several other UCSF medical students and I, with the help of many wonderful mentors around the world, founded the Planetary Health Report Card, which is a student-driven, metric-based initiative to evaluate and inspire planetary health engagement in medical schools. And there are a number of metrics that we use to evaluate schools across 5 categories. 1, curriculum, 2, research, 3, community outreach and advocacy, 4, support for student-led initiatives, and then lastly, campus sustainability. And in developing the initiative, we had a few goals in mind. We hoped that the report card would function as a needs assessment tool to identify strengths, opportunities for growth, and then be an institutional advocacy tool that engaged administrations in making the improvements. And then also in putting together the report cards, we hope that schools would be able to assemble synthesized medical school specific information on various resources offered that could then be disseminated to faculty, students, et cetera, as a useful summary. We also hope the summary report could facilitate cross-institutional dialogue, sharing of resources by showcasing examples of innovative forms of planetary health engagement at institutions across the world. And knowing that a program exists and then having access to associated links and contact information lowers the activation energy for leaders at another program to create something similar rather than having to reinvent the wheel. And our 2022 report will actually be released tomorrow on World Earth Day, so I encourage you to check it out at phreportcard.org. Although right now our website is undergoing some maintenance and preparation for that transition, so you won't see much if you go now. And then lastly, most importantly, we developed this initiative to do our small part in our available sphere of influence to advance the global planetary health movement in pursuit of a healthier and more equitable world. And since its inception, the report card has grown globally in ways we never could have dreamed of. This year, over 70 medical schools in 7 countries, US, UK, Ireland, Canada, Germany, Japan, and Malaysia, completed an evaluation. And then in the last few months, report cards for pharmacy and nursing training programs have been launched, led by international teams in those disciplines. And it's clear that the Planetary Health Report Card has also been successful in its goal to catalyze change. The majority of schools that participated last year and this year increased their score in the interim. And we've received so many stories of what schools are accomplishing, leveraging their results. So it's not just about doing a needs assessment and then sitting on the results. It's about creating proposals and writing grants and establishing new community partnerships with those results. And I'll leave it there. I feel like I've been talking for a long time, but thank you so much.
What a way to kick off this conversation. And Carly, I'm probably speaking for everybody. I'm a little blown away by what you've been able to accomplish while you're at UC San Francisco Medical School. I remember we did things as a group as medical students at USC, and I think we organized a talent show. That's what we came up with. So you sort of beat us by 100 miles. It's an incredible thing you've done, and it's such a great idea. It just seems like it has caught fire, probably a bad analogy, but you get my point. It has traveled around the world and continues to grow. And what I love about it in particular, and this is something we do with our local advocacy group of doctors here in San Diego, we work with a nonprofit in the climate space who's really good at follow-up. They don't just help get a bill passed within the region, but they make sure that it gets implemented in the spirit in which it was meant. Because a lot of times people agree to something, politicians in particular, and they sort of get distracted by the next big thing. But it doesn't matter if it doesn't incite change. So I really want to acknowledge the fact that you are following up and regrading, and there's nothing that works better than in terms of putting pressure on organizations to change than competition. So they're comparing themselves with these other schools that have signed up, and I'm sure they get even more motivated because they know they're going to get graded again next year. So it's an incredible thing. Anyone else from the group have a comment about Carly's initiative? All right. Well, and again, thank you for starting us off. That's just an amazing thing that you've created, and I really love being able to give you a platform to share about it. Switching gears a bit, Katherine, let's come over to you. You work with the American Public Health Association, which is a big, long-standing national health organization. How does APHA help support local grassroots climate action that also factors in equity?
Yeah, thanks, Bruce, for that question. I think first and foremost, by letting them tell us what they need. I mean, as a big national organization, we have to realize that we have lots of resources and enthusiasm, but not the local on the ground knowledge and experience that is really necessary when developing solutions. So I think it's important to navigate, you know, as a larger entity trying to support communities and support local action, that we do not know enough to be able to really lay out those solutions completely and equitably. And we need to work collaboratively with the communities that we're trying to serve and we're trying to work with and learn from and aid in their ongoing advocacy efforts, because usually there's plenty of action already going on in those communities that we are trying to help. So I think one way as a larger organization that we try to support local action is, you know, when doing analysis or creating resources or guides, we try to create things that are going to be applicable in lots of different communities that are going to be useful to lots of advocates across the country. That's easier said than done sometimes. We are working this year, the Center for Climate Health and Equity. We're going to work with a few of APHA's state-based affiliates to help explore some potential research and products moving forward that can be useful in several different advocacy efforts, because the area of climate, health, and equity, this intersection, while it sounds specific, really does cover so many things and so many local pushes going on across the country. And we're trying to be as useful as we can with the materials that we're putting out. Another way is by creating spaces for local efforts to build power and grow together. we are partnering with the Union of Concerned Scientists and the Moving Forward Network right now on an online platform called the Science and Community Action Network, or SciCan. That has been in the making for a while. We have lots of advisors and beta testers. 3 of us on this call have been involved with SciCan. Dr. Boston and Dr. Friedman have both been extremely involved in that effort as well. And we'll be launching in early June. And what that platform is designed to do is create a space for collaboration and connection among environmental justice communities across the country, a lot of whom are fighting very similar fights in their communities that could really learn a lot from one another, the victories that have been had, the setbacks that have been faced. So really creating a place for stories to be shared and connections to be made, also for resources to be shared that folks in communities have found useful when they're going up against a polluter or trying to get a regulation passed. And, you know, also an opportunity through the Science and Community Action Network for folks like me who have like ideas and research and analysis, and folks like Dr. Friedman, who's done this a lot in her career, to go and connect with communities and put that research to work and really have it benefit local, climate and health efforts. So, and that has to be done so responsibly. There have been so many stories, that we've all heard about, researchers or anyone just not connected to a community, kind of parachuting in, trying to, get their work out there, benefit from the community's experience, and then just bail, to put it lightly, I guess. So it's, we're also holding trainings so that folks that want to get involved and help these communities and maybe haven't worked with local communities in the past or with frontline groups in the past, to help them build the skills that they need and the knowledge that they need to really undertake these kinds of collaborations in a responsible way and a non-extractive way. So that was a lot, but on that last piece, but we're really excited about it and it's launching soon. And yep, there's just a link dropped in the chat for folks that want to keep up to date on that training opportunity that UCS is hosting, and also on the launch of the platform. You can fill out that form and we'll keep following up with you on that. But that was one long way, but a couple ways that we as a larger group try to support local action on climate.
Anyone else have a comment that's involved with this effort?
Yeah, I would just say, thanks, Katherine, for sharing all of that. That SciCan platform is a benefit to communities, and I am working with them. As a matter of fact, I'm one of the resources that's listed on SciCan, but I think it's an easy to use platform that communities often need information to support what they're doing. Is an easy platform to go and connect with those who are working in particular areas regarding climate justice, environmental justice, those community issues. So I'm looking forward to the relaunch. Is it a relaunch, Katherine? Because it was launched already, right?
Yeah, so you're in a very large beta group. So we didn't formally publicly launch, but I mean, we've got, I think 80 members of SciCan so far that have just been helping us build and shape the platform and make it as user-friendly as possible and as helpful as possible. So yeah, SciCan's out there. Some folks have been using it already, but we're doing a bigger launch and the full public launch in a couple months.
Yes.
Elizabeth, what's your connection to this effort? You're muted. There we go.
So I will get into my answers for my later questions. Well, my connection is that, I'm part of the core group that's helping design and build it. And I guess more personally, when I was in training and got involved in an oil spill cleanup in Kalamazoo, Michigan, there were a lot of questions that community members were asking about health. And geez, it looks like all of the people in this one area are starting to have these symptoms. Is that because of the spill? And then a few months later, there was another oil spill that was connected to the same industry, and also some of the same companies. And it was clear that there wasn't a lot of great communication and connection and trading of ideas and support of each other. And so that was sort of where the idea started. The title was very different at the time, and it was something that I kind of nurtured over time and shared with people, and actually there was a lot of strong negative feedback from a lot of leaders in the community, but over time, eventually there were people that would listen, including some really amazing community organizers and activists, and that's how we connected with Katherine and Dr. Boston. And then the title, Science and Community Action Network, actually came from Katherine. It's a great title, SciCan. So, so at this point, my job is to support where I can and provide resources where I can, and also know when to close my mouth and step back as an academician.
Great.
Period.
So one thing that I draw from hearing all of you that I think is a very positive sign in the climate movement is the maturation of that movement to now we really focus on collaboration and sharing. We're not all in silos and reinventing the wheel all the time. We talk to one another. I love this sense of community, almost family, that's developing amongst so many of us. For all the benefits that provides, and we might get into that a little bit more. But in terms of just pure effectiveness, it's so great to see all of the people in so many different locations collaborating on the creation of something, as opposed to one organization just hoarding it and then dropping it on people, and then, as Katherine said, disappearing, walking away. So the two things that come out right away to me in this webcast that give me hope are, first of all, that maturation of the movement and the collaboration that's really flourishing now. And then, Carly, young people getting involved, young people of obvious great ability and influence getting engaged. These are two things that really make me start to feel rather hopeful about the mess that we're in. Qasimah, let's pivot over to you and tell us about the Tallahassee Food Network and how you got involved with that.
I like how Carly started. I believe that stories stick too. So you're speaking my language when you said that. And so, yeah, I'll tell you about the Tallahassee Food Network, but I just want to start with a story as well, if I may. And so there's a people in the coastal South called the Gullah Geechee people, and they've been able to retain many African traditions and heritages. And one of the skills that they maintain is this skill of basket weaving. So in the photo, the promo photo that you had for this event, I have these earrings on and I wore them today, that are actually woven by those folks. So the reason why I tell their story is because there's a city market in Charleston, South Carolina. And in Charleston, South Carolina, is on the coastal area, and it's being threatened by a form of climate change that's called sea level rise. And right now, and that's where the basket weavers kind of congregate to sell their baskets, to make their baskets and that kind of thing. So this sea level rise, which is a component of climate change, is threatening the lives and the livelihood of those people in those coastal areas. So I just want to open up, because one of the things about the Tallahassee Food Network, we work on the stories of the people that we serve. So those stories are the things that motivate us, move us to work in this arena of environmental justice, climate justice. So it's the people. And so the Tallahassee Food Network is a people-oriented organization. We're listening to what the people are saying, and we're collaborating with them. We're partnering with those people in those communities to do our work. And the work could range from helping them to understand what's going on with them in terms of climate change, in terms of teaching and educating Also in terms of talking to policymakers and connecting people in communities to their local policymakers so that they can give them ideas and strategies for change as well. So the Tallahassee Food Network started about 12 years ago. And it was based on this issue of food insecurity. And we found that we were working on health issues, but we weren't really getting anywhere. So we dug a little deeper or took a deep dive, and we found out that the chronic conditions were related to the quality of the food that people were eating. And so we needed to do something about food insecurity to get to the root of the problem. Of course, food insecurity is connected to environmental justice, it's connected to climate justice, they're all interconnected. So all of those pieces of our work come together in the Tallahassee Food Network to work with communities to address problems related to not just food, but also to environmental justice. We are a diverse group of people from all kinds of walks of life. We have young people, older people, elders, as well as college-age students, community-based students, but we all come together to work on issues of environmental justice, climate justice, and food sovereignty. Our vision as an organization is this educated world that has food that is healthy, that's green, that's fair, and that's accessible. So in a nutshell, that's the Tallahassee Food Network. I could talk a little bit more about some of the things that we do, but I think that's going to come a little bit later in our conversation, if I'm not incorrect. But we connect to this global movement for environmental justice, this global movement for change. It's about humanity for us. We're human beings first, right? So part of our mission as human beings is to serve and provide help for one another. I think that's what this COVID-19 environment is all about. It's bringing us back to our humanity. So when we get there, then we'll be able to more effectively address issues of climate change, because we'll be thinking about adapting behaviors that save our environment so that we can live in an environment in harmony as opposed to a constant conflict. So I'll leave it there and come back to what we do later.
Thank you, Qasimah. It's an inspiring story, and I'm glad you reminded us all of this little pesky pandemic we just went through, because I think surely one of the lessons we have to take out of that is that we're all connected. You know, it is about individual people, and frankly, I think a lot of the joy in this work comes from being connected to people who we wouldn't ordinarily meet and whose lives are not like ours. Almost like the greater the distance is between us and those people, the greater the joy in being connected and working to improve the quality of their lives. So I acknowledge you, and I have so many questions about this food network, but you're actually, to be specific, you're encouraging people to grow some of their own food where they live, isn't that right?
Grow your food where you live, because, and that's part of what the work, not just encouraging people, it's part of the work that we do. We actually help people to build backyard gardens. We help people to build bucket gardens. We help people to build community gardens. There's several of them that we've built. And we say that everybody should have a backyard garden. If you can't have a backyard garden, grow something in a bucket. Because not only does that help you, but it helps the universe that we live in. Because plants do what? They absorb the carbon that's contributing to the climate change challenges that we have. So you're doing a whole lot of things when you grow some food, grow some peppers, grow a tomato, grow some greens. Living in Florida, it's easy to grow because most of the year, right, Katherine, it's hot. So you have sunshine all the time. So you can grow just about year round in a state like Florida, but understand the dynamics of your community is what we're trying to help. The nature in your community is what we're trying to help people to understand and utilize that to grow your food, to address this food insecurity issue that we're having. You know, and I'll add one other thing, is that we cannot leave out the social dynamics of what's going on in our society. A lot of the social determinants that we're faced with, the violence, the gang violence, the domestic violence, all those things are challenging to us as we do this work, right? This work of community building, this work of partnership and collaboration. We still have all these dynamics going on around us. So how do we do our work in a way that we can kind of like shift some of those social dynamics? And that's the kind of thing that we do. And it comes back to that word I said earlier, humanity. You know, humanity is having a challenge right now, and we can step up to the challenge. We can meet this challenge with all these beautiful people right here doing the beautiful things that you're doing. I know that we as a people, as human beings, can step up to the challenge.
Yes. And I'm also reminded of my days in medical school. It was a long time ago, but we had a half a day in 4 years on nutrition, on the effects of food on people's health. Carly, I gotta ask, is it more than half a day now in the 4 years you're going through at UC San Francisco?
My immediate thought when you said half a day on nutrition was, oh, that's more than we had.
Oh, no.
So I'm sorry to say not much has changed.
Well, I bet you the Planetary Health Report Card is going to change that.
That's the hope.
Yep. Okay.
Can
Elizabeth.
I
Yes,
jump in on to
Please.
continue this conversation around food security? Because we've been part of this. Well, first, it reminded me of this meme that I saw the other day. I'm not a big social media person, but I pulled it up and it says, Grandma survived the Great Depression because her supply chain was local and she knew how to do stuff. And I've been thinking a lot about this in terms of food security or food insecurity with our patients, and how, actually we have some pretty good programs at Children's Mercy around food and nutrition. One is we provide produce to patients that come in, fresh produce. Because sometimes if you have access to food, it doesn't mean it's access to good food, to healthy food. So I kind of wanted to touch on that. And I also wanted to touch on, since, we're here talking about climate change, in part, that being able to grow food, get food locally and support the local growers also, reduces that carbon footprint of massive food transport. So there are so many positive angles to look at this work that you're doing, Dr. Boston. It's very exciting, and I wanted to make sure we touched on a few more of them.
Thank you. Absolutely. And you said something key, that access to the quality and quantity of food to sustain life. Because what we found is we have so many food giveaways. There's so many places you can go to collect food. And we did a little study and we found that a lot of that food is not good for you. A lot of it is not quality food. But what happens when you have a need for something to eat? Because you have lack. And that's why I say those social conditions or social determinants are so critical to the work that we all are doing, because they're all interconnected. But I'm going to pass it back to you, Elizabeth.
Elizabeth, tell us what a pediatric environmental health specialist does.
Okay. Well, there are probably as many answers to this question as there are people who do it. For me, it's working in that space where individual health and community health or public health and environment come together. In practice, it can mean, determining if a health concern was caused by a certain exposure or a past exposure. Lead is the popular one to talk about. So looking for a cause and effect relationship. And then there's also how to manage that health concern or outcome moving forward, like removing the exposure. And that can refer to the individual health, but also community public health, which is, again, in the context of the national conversation around lead and changing over our pipes, and in the past removing lead from gasoline and paint. Traditionally, there's been a focus on chemical exposures, often in the workplace, which is where industrial hygienists and occupational medicine physicians work. And it can also refer to determining if an exposure that has occurred could be harmful in the future. This is a conversation that's happening right now around PFAS, per and polyfluoral alkylated substances. I think people know the Mark Ruffalo movie better than they know the chemical, Dark Waters, but this is a real national conversation that's going on. We know these chemicals do harm. How much harm do they do? When are we going to see the effects of it? So that's part of environmental health too. And then increasingly, we are talking about how changes in our environment and our ecosystem, like those related to climate change, or those related to decreasing usable natural resources, are going to affect the health of our patients in the future. So it's a lot, and some of us focus on one area more than others.
Right. But your story is interesting, and we've been talking about stories here. Qasimah and Carly have both shared theirs. How did you begin to get involved with environmental work? It was quite a while ago, if I recall.
Yeah, so I would say for me, it started with the environment and nature first. I spent a lot of my undergraduate studies focusing on ecology and environmental studies. I thought I might become an ornithologist. That's someone who studies birds. And I was going to move to the rainforest and work there. And I did stuff when I was younger too, with environmental groups. But then my academic career happened, and after undergraduate, further down my path, I took a strong interest in environmental health when I was studying public health. I did an internship with an environmental lawyer, working on a case that was near my home where I grew up. And then there was a connection to Peru, from Peru to St. Louis. So that was really exciting and interesting. And then later, when I was in medical training in Kalamazoo, Michigan, I got involved in this community conversation around the oil spill that I mentioned previously. And I thought, this keeps coming back. And this is really something that could hold my interest for a long time, perhaps more so than some of the traditional medical conversations. So I did some research and a lot of informational interviews with people who were doing things that sounded like they might be interesting to me. And I started moving in that direction from there. I found the PACEs, the Pediatric Environmental Health Specialty Units, and I started emailing those folks probably ad nauseum until I got a response. And since,
And here you are.
Here I am.
Fabulous. Katherine, I think this question that we got from Debbie might be something that you would have something to say about. When Carly was speaking, she wrote about how do we get current doctors to receive training on how climate change is going to be affecting their patients? Is APHA doing anything? Well, I know some of the things you're doing. Why don't you talk about that?
Yeah, I can definitely talk about. So Carly can speak more to medical schools. We at APHA represent public health professionals, which are not necessarily doctors. There's overlap there. There are people who do both, but focus more on public and community health professionals rather than clinical, physicians. But a lot of our trainings and programs are open to anyone who's interested. So physicians could absolutely take advantage of those things. There are, lots of more and more every year, it feels like more outside sort of trainings and curricula on climate and health and equity. Bruce, ecoAmerica has your Climate for Health ambassadors, which we have been involved with in trainings in the past and partnered on. That's a really excellent training program. We have some shorter workshops on the topic. And then, we're also trying to look at the larger public health education space. There are some climate and health programs within schools of public health. A lot of them are at, larger elite universities, not necessarily accessible to everybody who works in the public health field. So this is an ongoing conversation about being able to provide more professional development and training opportunities and learning opportunities for folks who are already in the field. And that is definitely something we do with public health, that we try to get out there for really anyone else that wants to learn how to communicate on and teach these issues and address these issues. So I need to find the link, but I can also share just the link to subscribe to our newsletter, where we'll continue to post those training opportunities as the years go by as well.
Yeah, Elizabeth.
There are growing numbers of resources. I think what I see, fortunately, this time there are movements that are growing. There are more in number, but there are also movements that are just getting bigger, which is great. The Medical Society Consortium on Climate and Health is a consortium of a bunch of different medical societies: the American Academy of Pediatrics, the Academic Pediatric Association, the psychiatry group, the occupational medicine group, physiatry groups, internal medicine. I mean, the Medical Society Consortium as a whole, we represent hundreds of thousands of physicians around the country through their individual organizations. On their website, they provide a lot of educational resources. And there's also really a movement to support advocacy at the local, state, and national level. And so as a group, we work to try to elevate our members. And so that's one resource that might be useful to whoever asked the question. And then I also put in the chat box the Global Consortium on Climate and Health Education, which doesn't just focus on medical training, but focuses on health programs in general. But if you go to their member site, you can see that medical schools as well as nursing schools and public health programs have also joined. So that's a great place to find resources and also support to advocate for curriculum development or change at individual institutions. And there's a group at University of Kansas on the other side of the state line that's been doing some of this work. So it takes work to get that information integrated into the curriculum, but there are resources to help people do that.
Great. Thank you for sharing those resources. And I do also want to say another word or two about the Climate for Health Ambassadors training, which is a half-a-day training that's available through your organization that you work with in direct connection with ecoAmerica, or people can sign up for it individually. Again, it's a half-day training, and it's not only about the science that links climate change and health problems, but also about advocacy. And it's a really well thought out program that I think makes this whole task of getting involved a lot more understandable and approachable, which I think is what most of us in medicine need. We get it. I think most of us, certainly there's a big trend going on in healthcare now across the board of people that understand this risk, but what they often need is just a way to get started, kind of an on-ramp. And I think that the ambassadors training is an excellent way to get people involved. But I also want to make a pitch for just the idea of getting involved in your local community, literally just Googling climate change nonprofit near me and seeing what comes up. We have a number of them in San Diego, Sierra Club and 350.org. I work with an organization called the Climate Action Campaign. We have a doctors advocacy group we've organized under them that guides us through our efforts. But one of the most important things, and this kind of runs counter to our training in health professionals, is that you don't have to have years and years of teaching to get busy in your community making a difference, that really you already know enough. You understand health problems. You have concern about your community. You get the link between those health problems and whatever's going on in terms of climate change. Qasimah mentioned sea level rise is a real factor, and food deserts are a real factor where she is. Where we are in Southern California, it's fires and heat waves, drought. We get those links. We see the impacts on our patients. You don't need years of experience or even, hundreds of hours of reading to be able to connect those dots for an elected official. You just need to get started. And I really want to encourage people who are thinking about this to get involved. So we have just a couple of minutes left. I want to ask Qasimah again, how would someone who's interested in the equity side of climate's impacts, how would someone maybe from a more privileged background connect to efforts like that? It sounds like you've got a broad diversity of people engaged with your food network. How would someone get involved?
We do have a broad group of folks that we work with. And one of the projects that we have is something called Collards and Cornbread. Collards and Cornbread is an opportunity for dialogue and conversation about these issues related to climate justice, climate change. And it's also a space where we can discuss even what equity is, because what we're finding in our work is that people have different thoughts about what equity is. So in that environment, that Collards and Cornbread environment, it's open discussion and it's peaceful discussion. And it's honoring the differences that people may have type of discussion. So that's one of the opportunities. And we get people from all types of backgrounds, from the very rich to the people that don't have a lot of dollars, from the women to the men to the children to the older folks. So we get all kinds of people because it's an open dialogue and it's a space for learning and growing and becoming stronger. So that's one of the opportunities that we have where we can discuss issues like equity. And then even on the neighborhood level, in Tallahassee, each neighborhood has a neighborhood plan. So once we can have a conversation and share information and help people to be educated about these terminologies and terms that we're using, then we encourage them to put them in their neighborhood plans. Put equity in your neighborhood plan. Put climate justice and environmental justice in your neighborhood plan. Now, after the plan is action, right? So that's how, we do that level. One way we do that level of work. The other thing is we have a garden called the I Grow Whatever You Like Youth Empowerment Garden. It was started by young people. And twice a week, we have gatherings in that garden where people can come and volunteer, people can come and just enjoy the peace and that kind of thing. And many people come from all over the city. And that's an environment for sharing as well. And even establishing partnerships, because sometimes there'll be a two-person partnership where they decide that they're going to work together on an issue. Or it could be a young person and an older person where they decide in that garden that they're going to work together on an issue. So in terms of equity and moving to action, because that's what we want now. We want equity action, not just a conversation about it. But those are two environments where we're seeing that kind of conversations happening for action. Excellent. I could express more, but those are two.
Thank you so much. We're actually getting short on time, and I want to have just one final question, and any of you can chime in on this one. Sri asked, are there any existing model climate, health, and equity policies that are ready for adoption at the local, state, or national level? Anyone?
Well, let's say on the national level, I work, the Tallahassee Food Network works on the local, regional, state, and national level. And on the national level, we work with a network called the Moving Forward Network, MFN. And within the Moving Forward Network right now, we have an initiative where we're working to push the EPA or encourage the EPA to be a little bit more stronger in the rules for the truck rules in terms of their exhausts. You know, they're working on those rules now, but they're kind of mediocre, and where they could be stronger in terms of protection of folks' health in our state. So that's one initiative that we're working on, and that would be policy. And we're working very strongly nationally to get folks around the nation to talk with their state representatives, and then to issue commentary and be a part of this movement to move EPA to be stronger with their truck rules. And I say truck rules, I don't know if the audience knows how important that is, because the trucking industry, the transportation industry, emits a lot of the exhaust in the air that's contributing to climate change. That's the zero emissions movement and that kind of thing. So we're trying to move EPA to make stricter laws to protect our air.
Great. Anyone else?
Yeah, I was,
Please.
oh, go ahead. Oh, okay. I was just going to say, I think that's a great example of a national policy, because I mean, when you ask, the question was sort of model legislation on climate, health, and equity. Again, even though it sounds like a very specific area, there are so many pieces of legislation that sort of fall in that window. There are sometimes examples of big sweeping climate bills that touch all different sectors. Maryland just had one this year that they were advocating for on a state level. But usually you'll find bills like the one Dr. Weston just referenced, focusing on specifically heavy duty transportation. There are bills focused on the rest of the transportation sector, on the agriculture sector, on the energy sector. All of the climate is such a huge issue that touches really every piece of our lives, every industry. And to be able to regulate enough to be able to act ambitiously enough to really achieve the climate goals and avoid just even higher levels of climate catastrophe, which we are at the doorstep of. You have to work across all of those sectors. And a lot of the time, it's not just one big piece of legislation that sort of checks all the boxes, which is why I think it's so daunting for some folks that want to get engaged on these things is, where do I start? There are so many things to fight for in this space. And I think that's why it's so important for us to come together and find, groups to join and find coalitions to join and work together, because we are so much more powerful in communities, at the local level, where we can learn from one another and work very directly with each other, but then in larger coalitions as well, so that we can tackle just like the enormous breadth of this issue, which is, again, like I said, it's daunting and it can seem overwhelming, but it is definitely something that we are seeing so much progress on, and that we are building so much awareness and support for, and that we are just coming together to help solve, which is a really beautiful thing. So yeah, while there are lots of great individual pieces of legislation, there will always be more, and they will be touching all of the different sectors. And it is definitely important to find folks to work together with on that and collaborate with.
Thank you, Catherine. Elizabeth or Carly, do you have anything to say to this last of our questions?
That was a really nice encompassing, bringing us to a closed statement. I did want to mention the cumulative impacts work that's going on in New Jersey, because I think they've really brought equity to the forefront in that conversation, which we don't always see in policy development. And then what I've seen here locally from an environmental justice group called Clean Air Now is that they are looking at local plans, neighborhood plans, city plans, and then providing recommendations to push for a more equitable response and follow-up. So it might not be a policy that's ready to launch. However, it's a way for individuals and groups really interested in equity and making sure that their communities are being community needs are being addressed. I think responding to policy plans, climate plans is is one really good way to start to ensure that equity is actually included in that conversation.
Right. Carly, last words on this or anything else?
There's a few examples that come to mind, but I think that my co-panelists have better policy expertise than I do, and you all summed it up so nicely. So perhaps I'll let it end there.
Okay. And you are creating or leading to the creation of all kinds of people in healthcare with your work that are going to be more open to these kinds of efforts and looking for them as they come out. So I think your work is going to have a tremendous amount of impact as time goes on. Anyway, that concludes our time today, but I want to thank you, Carly and Elizabeth and Qasimah and Katherine from APHA, our co-host for this webcast. And really thank you all for inspiring us to be bold in our thinking and actions about climate to improve the health of ourselves and our families. For all of our listeners, please click on the link to the survey when this webcast ends to provide your feedback. If you're watching this on YouTube, check out the description below to let us know what you think. Engage with us online with the hashtag Let's Talk Climate, again, all one word, and be sure to subscribe and follow us for the latest thought leadership, resources, and episodes on climate action and advocacy. From everybody at ecoAmerica and Climate for Health, thank you for joining us. Please join us in caring for our climate in order to care for our health. Be well, stay safe, and take action. Thank you.